Imagine feeling at odds with your own body. You wake up every day, looking in the mirror, and you just don't see you. For many people, that feeling of disconnection comes from living in a body that doesn't match their gender identity. Testosterone therapy, or T-therapy, is a powerful tool to help align how someone feels inside with what they see outside. But before starting T-therapy, there are crucial things you need to understand: the benefits, the risks, and what you might experience along the way. If you've ever wondered what T-therapy is, how it works, or if it's right for you, you're in the right place. Section 1. What is T-therapy and why do people consider it? T-therapy is a type of hormone treatment that helps people develop typically masculine traits, while reducing traits often associated with estrogen. For those who experience gender dysphoria, which is the discomfort of being in a body that doesn't align with their gender identity, T-therapy can be life-changing. Many seek T-therapy to make outward changes that reflect who they feel they are inside. These changes can involve things like the growth of facial hair, a deeper voice, and even shifts in the way fat and muscle are distributed in the body. For someone who has felt like their body doesn't match their true self, these changes can bring immense relief and confidence. Section 2. How does T-therapy work? The hormone testosterone is the key player in T-therapy. By taking testosterone, the body reduces estrogen production, and this sets off a cascade of changes. Here's a quick breakdown of the different ways T-therapy is administered. Injections. This is the most common method, where testosterone is injected into a muscle or just under the skin, usually on a weekly basis. Oral pills. Another method is to take testosterone in pill form twice a day. Transdermal. Through the skin. This can be done with patches or gels applied directly to the skin. Each method has its own benefits and risks, but they all work to increase testosterone levels in the body and encourage the development of typically masculine features. The choice of method often depends on personal preference, availability, and guidance from a healthcare provider. Section 3. Physical changes. What to expect on T-therapy? It's often called a second puberty. Like the first puberty, T-therapy brings about gradual changes that can take anywhere from a few weeks to several years to fully develop. Here are some of the changes people on T-therapy commonly experience. Skin changes: thicker, oilier skin with larger pores, and a greater likelihood of acne, especially in the first year. Facial hair growth. Some people start noticing hair on their face within a few months, while for others it takes longer. Voice deepening, one of the most desired effects for many, and it typically begins within a few months. Redistribution of fat. You may see a reduction in fat around the hips and thighs, with a corresponding increase around the abdomen. Increased muscle mass. T-therapy can lead to greater muscle growth, particularly in the arms and legs. Section 4. Emotional and mental health effects. T-therapy doesn't just change how you look, it can also change how you feel. Many people report a decrease in emotional highs and lows. They often say they feel calmer, or that they experience emotions differently. At the same time, the positive psychological effects can be huge. T-therapy can reduce feelings of gender dysphoria, making it easier for people to feel comfortable in their own skin. Studies show that many people experience a boost in mood and quality of life as they go through these changes. Section 5. Reproductive and sexual health on T-therapy. While T-therapy can align the physical body with one's gender identity, it also affects reproductive health. Some changes to expect include menstrual changes. For many, periods become lighter and shorter, and eventually stop altogether. Fertility changes. T-therapy can reduce the likelihood of getting pregnant, but it doesn't eliminate it entirely. Sexual changes. People on T-therapy often report an increase in sexual desire and different experiences of sexual pleasure. If someone is interested in future fertility, it's essential to talk with a doctor before starting T-therapy. In some cases, it may be possible to preserve eggs for future use. Section 6. Risks and possible side effects. Just like any treatment, T-therapy comes with risks and side effects. Understanding these risks is essential to making an informed choice. Acne. For most people, acne is a temporary side effect that improves after the first year. Hair loss. T-therapy can lead to male pattern baldness, especially for those with a genetic predisposition. Cardiovascular risks. Testosterone can increase blood pressure, weight gain, and salt retention, which raises the risk of heart disease. Additionally, some side effects are irreversible even if T-therapy is stopped. These can include changes like voice deepening and facial hair growth. It's a serious decision, and one best made with full understanding and medical guidance. Section 7. The process of starting T-therapy. If you're considering T-therapy, the first step is to meet with a doctor who specializes in gender-affirming care. This doctor will do a full health evaluation, which may include blood tests to check hormone levels and overall health, physical exam to identify any conditions that could affect treatment, mental health assessment. This can help you explore your goals, expectations, and readiness for therapy. Doctors may also discuss potential effects on fertility and recommend specific screenings, such as for breast and cervical cancer, depending on your age and medical history. Section 8. Staying safe and healthy on T-therapy. Once you begin T-therapy, regular checkups are crucial. These checkups allow doctors to monitor progress and catch any adverse effects early on. They'll track things like blood pressure, cholesterol, and red blood cell count to make sure you're on the safest path possible. It's important to remember that results will vary from person to person. Factors like genetics, age, and overall health play a role in how your body responds. Staying informed and working closely with a healthcare team is the best way to ensure positive outcomes on your journey. Conclusion: T-therapy is more than just a physical transformation, it's an opportunity to align your body with your true self. By understanding the benefits and risks, you can make empowered choices and feel confident as you take this step. Whether you're considering T-therapy or just curious to learn more, you've taken the first step by educating yourself, and that's something to be proud of. Remember, this journey is deeply personal, and there's no one-size-fits-all answer. Always consult with professionals and listen to your body as you move forward on your path. Thank you for watching, and remember, your body, your choice, your journey.